Hello. So I've been doing some of these videos to talk about the dementia. And we've done several with cognitive function, the Alzheimer's disease, gene APOE4, and many others. This time I'm going to talk about dementia in women. There's a reason for it. The women are more likely to have dementia than men of the same age group, especially the advanced age group. Again, people have done several studies to find out the reason for it. And as in the past, whether the tea is better or the coffee is better, people have talked about use of hormones, replacement therapy in women after the menopause. So the menopause sets in women anywhere between 40 to 50, maybe sometimes early, sometimes late. And it could be surgical if somebody has taken out the ovaries and the uterus, especially the ovaries, which produces the hormones. And sometimes it is related to the natural menopause, which may occur prematurely, or the natural menopause which occurs it. Menopause has several symptoms, and to treat them, people have been put back on hormone therapy, which includes combination of estrogen and progesterone. So the question has always been, is the replacement therapy of hormones, estrogen, progesterone, contributing to any additional mortality, morbidity in women? And there was a 2002 study that showed some results, and since then, the use of hormone replacement therapy has gone down. The study has a lot of loopholes and not the best one to depend on. And subsequently, it actually had shown relationship with cardiovascular disease, the clots in the legs as well as in the lung, DVT and pulmonary embolism, and some other additional problems that occurred with hormone replacement therapy. Since the study came out, the impact was that the hormone replacement therapy dropped by almost 30%. People have realized that that particular study was at fault. It was not the best study, and that is not true. Now again, a new one appears, whether there is a relationship of use of hormones and dementia in women. So actually they haven't measured this particular article that I'm talking about was published very recently in JAMA, Journal of American Medical Association. And it looked at the scans of the brain of women. I think there were 190 or 192 scans that they saw. And they looked at the amyloid protein and tau. As you may recollect from my previous videos, that deposition of amyloid in the brain and collection of tau has increased incidence of dementia. And if you remember, one of the studies that I had quoted was that slow wave sleep or deep sleep tends to clear some of these abnormalities that are seen. So what they did was they took out these scans of 192 women, and I think there were corresponding same age men, and they compared the amount of amyloid and tau protein. What they found out, and this is the interesting part, they found out that amyloid deposition occurs much earlier, but the tau protein was higher in women that were put on replacement therapy with estrogen, progesterone for menopausal symptoms. However, it was an interesting dichotomy. And this is where the importance lies in knowing the study and actually doing more studies in that direction. So if the menopause occurred at age 40, 42, 45, whatever, but the hormone therapy was not started for 5 years. So there was a gap where the menopause occurred and the hormone therapy was started. Then the incidence of accumulation of tau protein was much higher. Again, I'm going to repeat it. If the hormone therapy was started 5 or more years after the menopause occurred, the tau protein, which is an indicator of development of dementia in future, was more. However, if the hormone therapy was used within or less than 5 years after the menopause set in, this particular accumulation was not there. So basically, practical part of this is, let's say somebody is 65 and has significant symptoms, or say thinning of the bone, osteoporosis, and you decide that combination of menopause, thin bones, and we should use treatment for osteoporosis with hormones, hormone replacement therapy, and of course the other treatment for osteoporosis or osteopenia, then the incidence of dementia might be more. Now again, they did not follow these people for dementia development, so the follow-up was not there. It was just the comparison of accumulation of tau protein and amyloid in these women and these comparable men. Contrast to that, when the hormone therapy was given to the women before 5 years had ended after the menopause sets in, then the tau protein accumulation was not there. So if you believe in amyloid deposition, and if you believed in tau protein cause and relationship of dementia, which has not been established, but there is a suspicion for it, and high suspicion for it, then yes, if you are going to start the hormone replacement therapy, you should start it immediately or within first 1, 2, 3, 4 years. And that is likely to benefit women from developing dementia, or at least the tau protein retention on the scans. Amyloid is entirely different. So amyloid deposition starts early, but if you do the hormonal therapy in menopausal women within first 5 years, it seems to prevent tau protein accumulation. Whether this is going to be effective in preventing dementia or not, that is to be seen, because in this particular study there was no follow-up to see if these women who had tau protein had developed dementia, say 10 years down the road. So what do we come out of it? I think there is something to be said about it. Number one is that hormone therapy given early is not necessarily likely to cause increased incidence of cardiovascular disease, osteoporosis, primarily clots. Certainly estrogen is known to cause hypercoagulation or developing clots, but benefits of hormone therapy outweigh that, and the 2002 article was discredited, and most of the people still quote that article. So there should be an individualized treatment with hormone replacement therapy in menopausal, postmenopausal, and late people. One has to be careful when one uses hormone replacement therapy in elderly people who had menopause 10 or 15 years ago. That certainly seems to increase the tau protein accumulation. And if the tau protein is actually causing the dementia, then it certainly is detrimental. So to summarize it, this particular study did show that if hormone therapy was done 5 years after the onset of menopause, it increased the deposition of tau protein. Beta amyloid was already there for a while, and this may cause the dementia. Contrast to that, if the hormone therapy is given within first 5 years of onset of menopause, it did not cause increase in tau protein and may be preventive for development of Alzheimer's disease, which is to be seen, as this particular study was flawed because there was no follow-up for dementia, or even these people had normal cognitive function when the study was done. The second thing was the study was done as more like the scans rather than actual functional analysis. So one has to determine the benefit-risk ratio and decide if it is beneficial to give the hormone therapy for menopausal symptoms or not. I hope you like this. Thank you for watching. If you like, please subscribe. Thank you. Have a nice day.